that trust thing, I think, who do we trust? And I think this is where we are. We're in an era of, first of all, ignorance, but also a lack of trust. And the people who have engendered trust, not that they're always trustworthy. So we've had 40, 50 years of institutions, with letters, they're letters, acronyms for different things that we trusted, and then we haven't seen results. So now we go from, we trust, we donate, we are invested, and then overnight, they all are trash. They're out for themselves. They're boule. So you have these institutions that didn't engender trust in the last few years, maybe decade or so. And now we don't have a place to turn, because we used to be able to turn to the church. And now there's so many pastors that are not trustworthy. There's so many churches that are out for profit. And it makes like everybody. Now there's some good ones, but because of the institutions now have these blemishes, who do you trust? So now folks go down these rabbit holes on social media, on YouTube, on Reddit. And we see it both with the Trump people. We're talking about the same kind of energy with folks that follow Trump. They're only going to believe if it comes from this network or from Trump's mouth. They're only going to believe it if it comes from this source that's questionable, And now people who have actually done the research, I don't trust you because you have a PhD. What? You have a medical degree. You think you're better than me, so I'm not going to try. It's so weird.
And I think that's a hard thing, because it is true that oftentimes folks who are quote unquote experts are very condescending and don't treat others with the kind of respect that engenders trust, right? But I say, on the other hand, as someone who has lived with chronic diseases for most of my life, I have lupus, I have Graves' disease, and various other things, that one of the ways I managed that, because I have had my own experiences with being dismissed or with being condescended to, or with having physicians not listen to me, is I always take my healthcare in my own hands. And I don't mean that I just sort of read indiscriminately. I mean that I try to read medical research. I ask for multiple opinions from multiple doctors. Like, I try to find sources that are experts, but not just one, right? And try to cross-reference information as a way of taking care of myself. And I think that that's really, it's the combination of expertise, but also feeling like you have some control for yourself over what you're taking in, and knowing that so it's not just, and I also think it comes from, trust shouldn't just come from the position someone has, right? It comes from their track record, right? And how they have shown themselves to be in relationship to various communities over a career, right? So I'm not going to, I've been mistreated by plenty of doctors who I would never trust, but I also have doctors who I have seen what they research, way they interact with me, how they talk, how they communicate information clearly. That is part of how the trust develops, and you can see even on social media, there are ways that different physicians move, right? The way they talk to people, the way they, it varies. And I think so we have to apply that discernment even for the quote unquote experts.
When it comes to advocating for yourself, particularly in the medical community, and I'm asking this because you just offered up your own personal experience, and so I'm always curious. I get an opinion from Dr. A.
Yep.
I kind of trust it, but something's not right in my spirit, and I feel like I need something else. How do I go about getting that second opinion? Do I tell Dr. A, hey, I questioned this, so I'm going to cheat on you and go behind your back and get another doctor? And I mean, even framing it that way as if we owe some allegiance to a particular doctor is a wrong frame. But how do you go about just mechanically? What are the mechanics of doing that?
Really is arduous, because especially once you're talking about specialists, you might have to wait several months before you get the second opinion, right? Or the third opinion. If you have a demanding schedule, demanding life, that adds more constraints, and depending upon your insurance, it might be hard to do. So I don't mean to say that it's easy, but I guess for me, it's it's sort of this question: nobody is going to value your life as much as you do. Okay. And so I do think sort of going through that effort, especially, for example, I'll talk about my thyroid since I brought up, but I've had the recommendation, have it removed. And I say, well, I'm on medication now. If I have it removed, I'll definitely be on medication for the rest of my life. So why am I going to go through the surgery, right? So just asking more questions like, well, what happens afterwards, right? And then, so it's both with the first doctor, and then I talk to other doctors months later, right? And it's been a multi-year process. But so yeah, and I don't think we don't owe, I mean, sometimes doctors will act that way, but we don't owe loyalty
Right.
to a physician. They provide care.